Good evening, good morning, good afternoon, wherever you're watching from. Welcome to Winning Wednesday. It feels so good to really be dedicating time to becoming a well-educated, well-rounded, less stressed nurse. So I want to invite you into our broadcast today. My name is Professor Regina Callion. I am so happy that you have joined me. We're going to be talking about TPN. Now, why am I talking about this? Okay. Why am I talking about this? First of all, though, I think there's somebody in here that passed NCLEX. So let me shout out. Hey, look at this testimonial. This is what it's all about. She says, I love it right here. She says, I passed my NCLEX June 26th. That is a few days ago. That is under the new test plan. And she passed it in the minimum 85 questions, which means she knew the content. The exam recognized that she knew the content, and they were like, get her out of here. She's already going to get licensed. We don't need to ask any more questions above the minimum. This is phenomenal, guys. Thank you, Professor Regina. I trained with the V2 last summer when I took the PN, and passed in 85, and now I'm an RN. So this is a double graduate of the virtual trainer for the PN and the RN. And what I like about this is a smart lady right here, because she said, if it ain't broke, don't fix it. Use the VT, the V2, the virtual trainer for the PN, and then bring it back for the RN. I love this. This is what I want for you. I want you to be able to have the same journey, the same experience, doing the work, taking the test, not being fooled by distractors, but having a solid foundation. And do you know what's really amazing about this testimonial is that when you have healthcare experience, it is hard for you to pass an exam for new nurses. So a practical nurse taking the registered nurse exam, sometimes they struggle a bit because they just bring that hospital experience, that healthcare experience into the exam room, and it doesn't serve them. So I am so elated about this testimonial. I really am. I'm so elated about this testimonial. So congratulations. Now, this started off Winning Wednesday actually quite phenomenal. Actually quite phenomenally. If you needed to be encouraged, that was it for you. People are passing this NCLEX in this season. There's no reason for you not to be one of them. If you are not doing the work in the virtual trainer, you are missing out, because it's going to give you the content, and you're not going to have to wait around for a live class. You're not going to have to wait around for somebody else to tell you it's time to go. You're able to do it. And so Winning Wednesday is about celebrating the victories that are happening every day that are keeping you motivated to keep going. The days are long. The days are hard. Okay? But if other people are maintaining, if other people are able to keep going, then so can you. We're going to be talking about TPN today, and I have some questions. I have some questions on TPN. So let's get into it. Let us get into TPN. All right. So are you ready for the practice questions? Come on now. I am so excited. I am so excited. So let me know if you're ready. Put ready in the comments. Let me know. All right. So we are going to get started. Thank you so much. You are ready. Let's go. I'm waiting for you. Here's the first question. Okay. First question is this. We're going over TPN. Which client on TPN should the nurse assess first? Take a deep breath. Let's read them. Number 1, triglycerides 250. 4 hours into the lipid infusion. 2, a temperature of 100.9, 1 hour after a new TPN bag was hung. 3, the glucose 185, 2 hours after sliding scale insulin. Or 4, a mild pick site tenderness, no redness or drainage. 1, 2, 3, or 4, what are you all going to say? Very, 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 very much a safety question here. Here we go. Correct answer is going to be number, good job, it's number 2. Number 2. Good job for those of you who got it. Good job for those of you who got it. All right. Let's go on to the next one. And this is why, because you have a fever, which is an abnormal assessment. It's an abnormal assessment. So that's going to be the reason why this is the priority. 3 is bad. 3 is bad. Glucose 185, 2 hours after sliding scale. So it's number 2 as the priority. Okay, here we go. Next question is this. I showed the answer. But a subclavian TPN dressing is intact, dry, and 6 days old. Facility protocol states change dressing every 7 days. No fever and the site looks clean. What is the best action? Okay, so no fever, site looks clean. Number 1, change it now since TPN carries high infection risk. 2, leave it until 7-day protocol. 3, change it if drainage or loosening occurs. 4, request an order for daily changes. Yeah, good job. Leave it until 7-day protocol. This is going to be very important that you are able to follow directions. It's very important that you're able to follow the directions. Okay, good job. Let's do another one. Come on in. We are doing practice questions on TPN. As you are preparing, this is a huge concept for RNs to know, to be able to manage, right? And also for practical nurses to be able to understand the reason that you give TPN and what are some danger signs of it. This is Winning Wednesday, so I do want to spotlight all of our testimonials. So hi everyone, I'm tuned in from Oregon and internationally trained from Kenya. I took my NCLEX on the 2nd of July and passed. I love this. I love when I read it. I am now a ReMar nurse. I'm a ReMar nurse. Another amazing testimonial. Who's next? Who is next? Right here. Who's next? Okay, let's get back into it. All right, this is a bit more reading. Take your time with me. A client receiving TPN through a triple lumen central line is also on IV antibiotics and a continuous heparin drip via the same catheter. The nurse notes visible precipitate forming in the TPN tubing near a Y connection. What is the most likely cause here? Number 1, the TPN solution has expired and is no longer stable. 2, the heparin is causing lipid destabilization in the TPN emulsion. 3, air has entered the tubing, creating visible bubbles that resemble precipitate. 4, calcium and phosphate in the TPN are precipitating due to incompatibility at the shared line. Let me give you some time to marinate on this one here. Just by what you answered, I can tell where your priority is. Oh, wait. Okay. Let me show you the correct answer. Correct answer here is number 4, incompatibility. Okay. We know that when you hang TPN, it should not be hung with anything else. All right. So you have TPN, you have IV antibiotics, and you have heparin going into the same catheter, even though it's a triple lumen. Okay. Even though it's a triple lumen. But what's happening is that precipitate, what's that? What does that mean? Is forming in the TPN tubing near the Y site connection. What's the most likely cause of this? If you picked number 3, then your major fear is the air embolism, right? So you see the word air and that was a distractor, you jumped on it. If you pick number 4, incompatibility, this just shows that you have a little bit more deeper understanding of TPN and the complications associated with TPN. Because typically, you're not going to worry about air in a triple lumen central line. Like, you're not going to worry about air. You will worry about putting a lot of things through that triple lumen and them being incompatible, especially if you start seeing particles. So I want you, when you're doing these questions, listen to me. You got to slow down. You got to slow down because the distractors are written to make you overthink. And a lot of you are so smart. You are so smart and you are so capable of passing this NCLEX, but you give the license away when you don't stay focused during the exam. Okay? You have to stay laser focused because the simple things are the ones that trip you up. Okay? You had no business picking number 3. Let me read what number 3 says again. Number 3 says, air has entered the tubing, creating visible bubbles that resemble precipitate. That's crazy. That's just crazy. Air bubbles are not going to look like particles. Okay? Particles are solid. Air bubbles are not going to look like that. Okay? So if it doesn't make sense, don't choose it. That's something else. Are you guys ready for another one? Let's do another one. All right. Boom. A nurse is preparing to administer TPN via a central venous catheter. Which intervention is most critical to ensure client safety during administration? Is it number 1, change the TPN tubing and filter every 24 hours to reduce the risk of infection? 2, check for bowel sounds prior to initiating TPN to ensure gastrointestinal readiness? 3, use a 22 gauge needle and flush with heparin before connecting to the TPN tubing. Or 4, program the infusion pump to deliver TPN at the prescribed rate using an inline filter. What do you say? Where my safe nurses at? Where my safe ReMar nurses at? So when I give you a job, You will go in there. Okay, so when you apply for Safe Nurse Now and we match you with a great job, you will go in there and you will be able to execute. Where are my safe nurses at? And I see we have two students here. We have students that are saying it's absolutely number one. And we are students that are saying, no, for real, it's number 4. And I think those are, if you can get it down to 2, those would be the best 2 that you are fighting for. So if you're in the test room and you can get it down to 2, you have to go with the one that is the highest level of safety for the patient. What is that going to be? Change that answer. Change it. I'm telling you right now. Which one is the highest level of safety for the patient? Okay. Hear my voice. Take my voice in there with you when you take this exam. The correct answer, okay? Listen to me. Listen to me, guys. I want you to think about the one that would have the immediate consequence. When I'm talking about safety, I'm talking about the one that would have the immediate consequence to the patient. Meaning, if you don't do this, because I think we have some prioritization issues here. If you don't do this for the patient, you are going to know right away that the patient is going to be in danger. Okay. Correct answer is number 4. Programming that TPN to deliver the correct amount is going to be much more important than changing the tubing every 24 hours. Number 1, changing the tubing has the risk of what? If you don't change the tubing every 24 hours, then your patient could be at risk for what? For infection, for a central line infection. Wait, is that bad? Is a central line infection bad? Is sepsis bad? Yes, absolutely. Absolutely. How long does it take for bacteria to grow and a patient to get an infection in central line? And this is just looking at what we have in front of us. I don't want you to think about any question prior or any question after. We are just talking about just some common fundamental principles. When a patient has an infection, when did that infection start? Did it start within an hour? Or did it start probably 2 days ago? Okay. Infections take time. It takes time for bacteria to grow. All right. Infections are bad, but infections are generally slow, meaning hours, days. Okay. So for this question here, what you have in front of you is number 1, which is an infection risk, sepsis risk, or you have number 4, which is programming the infusion incorrectly. If we don't program it at the right rate, how long will it take for our patient to have complications? How long will we see that patient changing? Okay, because this is what we're comparing. We're comparing 1 and 4. 2 and 3 are not even in this conversation. But I want to stay here because too many of you got this one incorrect. If we are supposed to give our patient 75 an hour, but we give them 750 an hour, if we were supposed to give them 100 an hour, but we give them 1,000 an hour, which is going to be the most critical mistake? That's what you're being asked. Okay? That's what you're being asked. So looking at this again with this understanding, what is the correct answer? Okay. Because this is what you're going to have to do on test day. Yes, okay, on test day. And so I love and I'm so happy that you came to class today. I'm so happy that you came to class. This is why you come to class, to work out your salvation on NCLEX. Okay? This is why we're coming to class. Got it? Got it, got it, got it. You got it now. Okay, let me see. Let me see. Do I have another one for you guys? You ready to do another one? Let's do another one. Let's do another one. Because I want you to still understand that during this process, you are still learning. I don't want you to be perfect, but we do have to be able to do what we can do. We have to be able to do our part. Here's the next one. Here we go, guys. Okay. A client who recently received TPN through a central line suddenly becomes restless, reports chest pain, and exhibits shortness of breath. The nurse suspects an air embolism. Which of the following actions should the nurse take first? Number 1, stop the TPN infusion to prevent further air into the circulation. 2, place the client in a left lateral Trendelenburg position to trap air in the right atrium. 3, administer oxygen 100% via non-rebreather mask to improve oxygenation. 4, notify the healthcare provider for emergency intervention. What do you guys say? Every time I do this one, good job. I'm waiting for people to come in. Every time I do this one, it's so important again that we are looking for the thing that is going to address the patient's condition. Okay, that's all I'm going to say. The correct answer here is number 2. Number 2 right now. You have to stop that air from getting to the where. Okay. So you have to put the patient in a position, because here's the thing. The nurse already is suspecting that this air is inside. So your patient's having symptoms. They're becoming restless. They become chest pain. Okay. Shortness of breath. The air embolism is already inside. You have to cut it off. So positioning the patient is going to be the priority. Getting that patient in the lateral Trendelenburg position is going to cut off the ability for anything to move. All right. And this one is tough. Why? Why is this one tough? Because typically what you're presented with is a patient is suspecting, or the nurse is suspecting air coming into the patient. She sees bubbles. What should she do? Then it would be turn off, the TPN. However, though, you have to really be careful, because you have to really be careful with this, because number 1, we know that TPN typically is not stopped abruptly. But also, more importantly, this patient is having symptoms. So you need to address the patient first. You need to do something to your patient first. Does that make sense in this scenario? Okay. And this is what I mean with NCLEX. It's a moving exam. It's challenging you. If you got the last question right, the next one will be a little bit more challenging. I'm expecting you. Let me tell you this. I'm expecting you to have a difficult exam because you're going to know the principles. You're already going to know the principles. So the exam will say, okay, this is somebody that has known something. This is somebody that's been trained. We got to bump it up. We got to make them think. And so that's what's going to happen, all right, for you. So get used to it now. I got to do more and more harder questions for y'all because you guys know the easy stuff. I'm not coming here to waste your time. I want to make sure that you are actually prepared for this thing. So you can cry now, but laugh later, okay? I'm going to make you, if you're feeling like, I got work to do, then I've done my job, okay? I'm here to cook you so that when you walk into that test room, you already been tried and been taken through the fire. So you're going to feel good, okay? All right, but now it's the cooking time, okay? So here we go. Y'all ready for our next one? I got questions. I got a lot of questions for y'all, okay, today. Usually I just do 2 or 3. A client on TPN has a fever, chills, and increased heart rate. The nurse inspects the central line site and should perform which priority action? Number 1, remove the central line immediately. 2, notify the healthcare provider and obtain a blood culture. 3, flush the line with normal saline to check for resistance. 4, administer acetaminophen. Why did I say that? And monitor the client. Which one we going with? Okay. This is Winning Wednesday. We're going to get over the hump. We are going to press on. Even when we tired, even when we sick, even when we don't feel good. I've been in the bed all day long, literally. And when it was time for Winning Wednesday, it was like the Lord gave me a burst of energy and was like, it's go time, y'all. So no matter what your day looked like, the fact that you showed up here, I know God is good. I know that you are in a different space because you had a lot of excuses not to come, but you said, I'm doing this for my future self. The me in the wintertime, the Christmas me is going to be so happy that the July me showed up. That's what I'm saying to myself, right? I am saying to myself, come winter, I'm going to be like the ant that has toiled all summer so that I can relax in the winter time. Yes. All right. Correct answer here is number 2. Number 2, notify that healthcare provider and obtain a blood culture. Patient has signs of infection with the TPN. You're not going to take it out. We're not going to, some of you picked number 1. You're not going to take that TPN out, that central line out. We don't do that. Nurses don't put them in. Nurses don't take them out. Okay. We will notify the doctor. We will do that. All right. So this is part of the process. You coming in, you doing the hard questions, you making your journey. Okay. And I told y'all, I'm taking y'all up this mountain. And this mountain is not flat. It is not paved with roses. It is not just going to be a cakewalk for you. Many people want to be nurses, but it's not something that's given to you. That license, you have to earn it. I'm sorry, but no, that license, those letters, you have to earn it. You have to walk up the mountain. And sometimes you're going to stumble, and sometimes somebody might come along and you might fall all the way back down to the beginning, and you got to do it again. That's for my repeat test takers. You might have to walk it 2 and 3 times, but you are going to get to the top. You know why? Because you were born to be a nurse. That's the thing about it. It's not something that you like. People that are born to be a nurse, you're going to be a nurse in some capacity anyways. You might as well have a license and be getting paid for it. Okay. I want you to see the goal, but I want you to also understand that the journey is real. Okay. The journey is real. And most people, when they are doing amazing things, they need a coach to do it. Even Olympic runners, even Olympic swimmers, even, all the best of the best, Serena, Michael Jordan, all the athletes, they all had coaches. I'm that coach for you because I'm not going to let you settle. Okay. You're not going to come here and play around. I'm going to tell you, it's not easy, but it's worth it. Okay. And so this month I have decided that this is going to be a cooking class. Every week, this is going to be a cooking class. And so if you need to be pressed down together, you know how you make a grilled cheese sandwich? You take that cheese between 2 pieces of bread and you heat it up. And then that thing can't be taken apart easily because it's been cooked. That's you. That's you and me this month. I want to make sure that you are absolutely prepared for this exam. All right. So what I want to do now, though, is if you have the virtual trainer, if you have your virtual trainer workbook, I do want to go and play a video from it. I want to play TPN so that if you have any questions about TPN, you can ask me now in class. I know we just did a couple questions, but I also want to show you how the program works. And so we are about to watch the TPN video, which is in the workbook, and it is on page, boom, boom, boom. It's around here somewhere. Here it is. Okay. So it's on page 46. So get out your books. If you bought the V2 during this last promotion, then this book is in your file vault. You need to print it out. If you physically purchase this book, then you have it in your hand. We shipped it out to you. So check and see if you have it. All right. So we're going to go in. Let me put the video up. TPN. Let's get ready to watch it. All right. Here it is. TPN. Fill out the workbook.
Total Parenteral Nutrition. Let's get into it. With TPN, this is actually a method of feeding that bypasses the gastrointestinal tract. So the way that we feed this client, we don't involve the stomach, the intestines, any of that, because we're using a special formula. So some may ask, Regina, how is this done? Well, what are the nutrients going through? They're going through the veins. They're actually going through the veins. So when nutrition goes through the veins, whose job is it to process that nutrition? What organ is now responsible for providing nutrition, right? You guys know it is the liver. So the liver metabolizes the formula, and then the body is able to receive it that way. So this is a very complex intervention. It is not given to everyone. Who needs TPN? The client whose GI tract is not functioning correctly. They need TPN. So these are clients that have issues with their bowels or their stomach. So for example, ulcerative colitis patients, patients with Crohn's disease, right? Where they need a real intervention in order to prevent malnutrition, because that's the goal of TPN. We don't want our patients to become malnourished, so we have to feed them this way. Now, NCLEX may give you a scenario where you have a pregnant woman and she's really nauseated, she's vomiting all the time, and they will ask, is TPN a good solution for this patient? What is your answer? No, absolutely not, because the condition is pregnancy. There's nothing wrong with the gastrointestinal tract. NCLEX may give you another example where they say you have a client and they have stage 4 cancer, they're getting chemotherapy, they're terminal, the cancer's in the lungs, the chemotherapy is causing them to be nauseated, they have ulcers all around their mouth. Do they need TPN? What's the answer? The answer is no, these patients don't need TPN. There's other ways we can feed a client if they're nauseated, if they have ulcers. We can put down an NG tube, right? And still use that gastrointestinal tract because it's normal. So the reason why we don't want to give TPN is because when the liver begins to metabolize food, it causes a great strain on the liver, and your client will start to experience some liver failure within a few weeks. So this is something that's reserved for severe cases. When you're given TPN, what labs do you want to monitor? Well, you want to monitor the blood glucose levels, because TPN is mostly made of what substance? It's mostly made of dextrose. And dextrose, a lot of glucose. It's all sugar. So what is it going to do to the blood glucose levels? Is it going to raise or lower them? It's going to absolutely raise the blood glucose levels. So clients on TPN have their blood sugar monitored every 4 to 6 hours. You're going to go around and check it. What electrolyte imbalances can TPN cause? These are the ones that I want you to know. Hyperkalemia, hypermagnesemia, and hyperphosphatemia. And this usually happens in the beginning because normally TPN has nutrition and electrolytes inside the formula. And so the body has to adjust to receiving nutrition in this way. Oh, if your TPN runs out, what is the emergency substitute for TPN? That is 10% dextrose. Yes, you never want to abruptly stop TPN. You always want to gradually taper it off. TPN should always be given on a pump, and 10% dextrose is your emergency substitute. I hope you guys feel a lot better about this topic of TPN. I hope you know who you can give it to, who you can't give it to. What is your emergency substitute? And how do we wean a patient off of TPN? We do it gradually. You are ready to move on to the next subject.
All right. Okay. So I was taking notes. Were you taking notes? The reason why I wanted to play this video is because my videos really go over the foundations of the information so that you can work from a place of critical thinking. You cannot critically think on stuff that you do not know. So during our question section, there were a few of you who chose principles that are not associated with TPN. Can I give you some advice on things that you never have to worry about with TPN? Can I do that for you? Can I coach you for a second after that video, just to make sure that we are all on the same page? Okay. So with TPN, remember, you never have to worry about giving medications with TPN. Never have to worry about that. You never have to worry about flushing TPN lines, okay? That's normally not going to be a priority for you because that TPN line is going to be dedicated. You're not going to give medications through it. Nothing is going to go through it but the TPN. And you're changing that TPN line every 24 hours. So that's not going to be a priority for you. Another thing, you are not going to worry about checking bowel sounds with TPN. Not going to be worried about that at all. And there were like a few of you who picked checking bowel sounds. Okay. Also, you are not going to worry about fluid overload with weight gain. Okay. And I know when we're giving things IV, it's sometimes a reactionary instinct that, oh, if the patient is gaining weight, that's fluid overload, right? But that's not the case with TPN. What is usually happening if a patient is on TPN and they gain weight? What's usually happening? Does anybody want to take a guess? Okay. What's usually happening is that the patient's nutritional status is improving. Because remember, their gastrointestinal tract is not functional. So usually they are malnourished. Yes. So when we start TPN and they're gaining weight, it's because, of course, their nutrition is improving. So that's actually a good sign. That's a good sign. So it's very important when you are in the VT, when you're in the virtual trainer and you're taking notes, that you are allowing the information to really get into your mind. You're not just aimlessly taking notes. And then you review that information. You review that information because the questions that I gave you came from the course. It came from the QBank. Okay. So with TPN, with TPN, let me get out the circle. I want you to write down 3 things in your book. So these are the 3 things that I wrote down at the bottom. And I know my handwriting is kind of sloppy, but to sum it all up, I wrote down sugar. Why did I write down sugar with TPN? Sugar. I wrote down sterile. Sterile. Why did I write down sterile? Okay. And I want you to make these connections. And then I wrote down slow when it comes to TPN. So sugar is because it can cause hyperglycemia. I wrote down sterile because you have to think of sterility with this procedure because it's a central line. And you want to even make sure that the tubing is changed. And then I wrote down slow because you do not abruptly stop TPN. You have to gradually reduce TPN. Okay. And that's how you use the virtual trainer. Okay. It's going to review content. It's also going to help you critically think. And then we didn't even get into the computer adaptive testing, but this is the work that I expect you to do. This is why ReMar nurses are passing when they operate in this paradigm concerning their preparation. You have to do all the parts the way that it is created for you. Okay? You have to do all the parts. So class was amazing tonight. I will be back again on next Monday. I have a webinar that I'm going to be doing with my partner, Teresa. We have if those of you heard about it, the Florida remediation for NCLEX-PN. So all of our nurses in Florida, if you have failed NCLEX 3 or more times, it can be so frustrating because you have to do a special remediation process. Well, guess what? I now have a specific way for you to get back on track in about 2-3 weeks. You can do it. Like, honestly, for real, if you really wanted to. So I want to tell you all about it, because with the Florida remediation, you have to do not only clinicals, but you get to do the virtual trainer together. So we have had people come from all over the country to do this amazing course. And you also get private coaching with myself, with Teresa. It's all in a package. I'm doing a webinar about this tomorrow night. Also, July 9th, 7 p.m. Eastern Standard Time. This webinar is going to explain all about how to get back on track after you failed NCLEX 3 or more times in Florida. To learn more about it and to register to hear the information, go to remarnurse.com/LPN webinar, and I can't wait to get you this information. It is going to really help you get back on track if you need to do Florida remediation for NCLEX PN. So great things are happening. I'm so excited about you getting your nursing license, you passing NCLEX, of course, is what I love to do. And at the end of the day, you have to see it for yourself. You have to get excited about it, and you have to believe you can, you will, and you must pass NCLEX. See you later. Bye-bye.